Imagine if you hollowed out hundreds of hospitals, destroying medical care for millions of vulnerable patients. Imagine that you got paid millions of dollars for your efforts. And imagine that happening year after year. Imagine allowing numerous women to be intimately assaulted in an Iowa hospital over nearly 2 years by a nurse who was stealing drugs from the hospital. And imagine nobody noticing, not because there weren't policies, but because there weren't enough staff. There wasn't enough oversight. There wasn't enough investment in the basic systems that keep patients safe. When the United States Senate investigated how this happened, they obtained over 1 million pages of internal documents. And what they found wasn't a story about one bad hospital. It was a story about a private equity business model that systematically extracts value from community services, bankrupting them and then abandoning them. The hospital was owned by Apollo Global Management, one of the world's largest private equity firms. And for years before the assaults, employees had been warning that something was wrong. Workers described a facility that was dirty and embarrassing. Leaking roofs, no running water in some bathrooms, equipment that doesn't work half the time. The infrastructure was literally decaying from a lack of maintenance. Meanwhile, Apollo was collecting over $9 million a year in management fees. Their portfolio company posted a $336 million loss in 2023. Apollo still got paid. It was all part of the plan. And this model is now spreading globally. From American hospitals to British veterinary clinics, from Australian dental chains to European care homes. Private equity has discovered something most of us don't want to believe. You can make more money dismantling institutions than building them. To understand how private equity profits from bankrupting hospitals, we need to understand the basic mechanics of a leveraged buyout. Here's the structure. A private equity firm wants to buy a company worth, say, $1 billion. They don't pay $1 billion in cash. They put in perhaps $300 million of their own capital, or rather capital from their investors, pension funds, university endowments, sovereign wealth funds. Then they borrow the remaining $700 million. That $700 million in debt doesn't stay on the PE firm's balance sheet. It goes onto the acquired company's balance sheet. The company now owes $700 million that it never chose to borrow. A normal company owes roughly 25 cents for every dollar of value. A PE-owned company starts life owing 70. There's almost no margin for error. Now, if the company thrives, generates cash, pays down debt, grows, the PE firm sells it at a profit, everyone wins. But here's where the model gets interesting. The PE firm doesn't just make money when the company succeeds, they make money along the way. The PE firm charges management fees, typically 2% of assets under management, paid annually, regardless of how the company performs. They charge transaction fees for buying, selling, refinancing. They charge monitoring fees and advisory fees. And then there's something known as dividend recapitalization. The PE firm instructs the company to take on even more debt, not to invest in growth, not to hire staff, not to maintain facilities, just to pay a special dividend directly to the owners. The company's debt goes up, its cash reserves go down, and the PE firm gets paid years before any exit, regardless of whether the company survives. Let me show you exactly how this plays out. In 2010, a private equity firm called Leonard and Partners acquired Prospect Medical Holdings, a chain of hospitals serving working-class communities across the United States. The purchase price was $363 million. Leonard put in $151 million for a 61% stake. By November 2012, just 2 years later, Leonard had already recouped that entire $151 million through debt-financed dividends. Their investment was paid back. The clock was reset to zero. But they didn't stop. In 2018, they had Prospect take on an additional $500 million in debt to fund another massive dividend payout. By December, Prospect had no cash left. They had extracted so much that the company needed an emergency loan from its own shareholders just to keep operating. Here's what the Senate investigation found in total. Prospect had paid out a staggering $650 million over that period. Leonard Green alone extracted $424 million during its ownership, plus another $13 million in fees. They nearly tripled their money. Meanwhile, Prospect's debt exploded from around $300 million in 2010 to over $3 billion when Leonard Green exited in 2021. And when they finally sold their stake, they received $11.9 million, less than 8% of what they originally paid, because the equity was worthless. The company was drowning in debt. What did this look like inside the hospitals? When Senate investigators reviewed board meeting minutes, they found something remarkable: virtually no discussion of patient outcomes or quality of care. The meetings focused almost exclusively on profits, cost-cutting, acquisitions, and managing labor expenses. In Texas, Prospect acquired a hospital system that was generating healthy profits. 7 years later, it had swung from millions in profit to tens of millions in losses. They shut it down. 972 people lost their jobs. The Senate's verdict: in only 7 years, what had been a profitable hospital system became a financial disaster. In Pennsylvania, Prospect promised to keep hospitals open for at least 10 years. 6 years in, they closed one permanently. 334 workers were laid off. The state attorney general sought fines of $100,000 per day for breach of contract. Here's a detail that should stay with you. Before Prospect's acquisition, one of these Pennsylvania hospitals had 0 serious safety violations on record. 0. But the moment they were acquired, they began receiving multiple citations for failures that put patients in immediate danger. Pennsylvania State Representative Dan Frankel captured it. These hospitals were ransacked, robbed, and plundered for profit. In Connecticut, Prospect cut hospital beds by nearly half in a single year. The percentage of emergency patients who left without being seen doubled to 4 times the national average. Inspectors issued a citation for inadequate care, resulting in a patient death. Now you might think this is an American problem. Weak regulation, fragmented healthcare system, couldn't happen elsewhere. But you'd be wrong. The same playbook is spreading globally. Private equity has discovered that essential services, healthcare, education, housing, care for the elderly, share certain characteristics that make them attractive targets. Demand is inelastic. People need these services regardless of economic conditions. Revenue streams are often government-backed, and customers, patients, students, residents can't easily comparison shop when they're sick or old or vulnerable. In the UK, private equity has been rolling up veterinary practices, dental chains and care homes. In Australia, they've targeted childcare centres and GP clinics. Across Europe, elderly care facilities and diagnostic laboratories have become consolidation targets. The model is the same everywhere. Buy fragmented local providers, load them with debt, extract fees and dividends, cut costs, which usually means cutting staff, and if the business fails, the debt stays with the company. The PE firm has already taken its money out. Academic research increasingly documents the consequences. A Harvard study found that PE-owned hospitals in the US had a 25% increase in hospital-acquired infections compared to non-PE hospitals. Falls increased by 27%. Surgical site infections doubled. A study of nursing homes found that 90-day mortality rates were 10% higher at PE-owned facilities. These aren't anomalies. They're the model expressing itself. So why doesn't anyone stop this? Part of the answer is structural. The PE model is designed so that sponsors face limited downside. The debt sits on the portfolio company's balance sheet. Lenders have recourse only to the company's assets, not to the fund that owns it, and certainly not to the partners who manage it. If the company fails, the PE firm has usually already extracted its investment. They can walk away. Leonard Green sold its stake in Prospect for $12 million and still made over $430 million on the deal. Part of the answer is informational. In the United States, the government agency that tracks hospital ownership doesn't even capture whether a hospital is PE owned. The public can't easily find out. Transparency itself is missing. And part of the answer is political. Private equity firms are significant political donors in every major economy. In the US, the carried interest loophole, which allows PE managers to pay capital gains tax rates instead of income tax on their performance fees, has survived decades of attempted reform. Similar structures exist in the UK and elsewhere. But mostly what private equity does is legal. Loading a company with debt is legal. Paying yourself dividends from that debt is legal. Extracting management fees while services deteriorate is legal. Walking away when the debt becomes unsustainable is legal. The system isn't failing to enforce the rules permit the extraction. I want to leave you with one detail from the Senate investigation. When congressional staff reviewed the documents, they found a legal deposition of a former Leonard Green director. The Rhode Island Attorney General had asked why, when the hospitals were generating cash, that money went to dividends rather than paying down debt or investing in facilities. The director's response was that she and Leonard Green saw them as a nuisance. The extra earnings, the money that could have maintained the hospitals, that could have reduced debt, that could have protected communities, that could have saved lives, a nuisance. That is the mindset, not malice exactly, just a model that treats operational cash flow as raw material for extraction. But where is this all heading? In the first quarter of 2025, 70% of large corporate bankruptcies in the United States, companies with more than $1 billion in liabilities, were private equity backed. 70%. Private equity represents roughly 6% of the American economy, but it accounts for a wildly disproportionate share of business failures. Over $1 trillion flowed into PE-backed healthcare acquisitions during the 2010s alone. The pace is accelerating, not slowing, and the same firms, the same funds, the same partners, the same playbook are now active in the UK, Europe, Australia, and beyond. This is not a story about bad actors. It's tempting to frame it that way. Greedy executives, corrupt politicians, villains in suits. But that framing lets us off too easy. It suggests that better people would produce better outcomes. The problem isn't the people, it's the structure. Private equity has developed a model where you can profit from an institution whether it thrives or collapses, where the debt belongs to the company but the dividends belong to you, where failure is someone else's problem. Economists call this moral hazard, when you can take risk with other people's money and face no consequences when those risks fail. But in private equity's case, it's not a bug in the system. It's the business model. The hospitals closed. The communities lost access to care. Patients faced longer ambulance rides, worse outcomes, and in documented cases, preventable deaths. And the firms that engineered it, they extracted their money legally, profitably. The question isn't whether this model will produce more failures. It will. The question is whether the next one will be the hospital where you take your children, the care home where your parents live, the dental practice you've been going to for years. The question is whether it's yours. Thank you for joining us at the Capital Desk. If you enjoyed the video, consider subscribing to the channel and liking this video. We would really appreciate the support. And of course, leave a comment. We would love to hear your thoughts and what content you would like to see in the future. See you in the next one.